Hi guys, happy Monday. Gosh, as everybody knows, yesterday was a tragic passing of Kobe Bryant and his 13-year-old daughter in a helicopter accident, as long as another family in Calabasas, California. So I've kind of just spent the past 24 hours like trying to process that. I grew up watching basketball my whole life. I played when I was in middle school and high school. It's been a really big part of my life, and Kobe Bryant had a huge impact on all of athletics. Anybody who has a drive to be a better person, anyone who has a drive to be a professional athlete, and especially the African American community. So I've really just been deeply affected by that, and kind of just working through that emotion of like, the loss that his wife and their family is going through. And, for her to lose a husband and a child at the same time, I just can't fathom what she's going through. So that's kind of what's been going on for me this past weekend. I worked over the weekend, and again, just kind of dealing with what happened yesterday. Still, it's been like a process. So anyways, the topic that I decided to cover was cultural competency, and it's especially touched in chapter 14. There was a video that was I think it was called Act, Speak, Think, Think, Speak, Act. And something that really struck me was these healthcare providers were talking about what it's like when you are getting healthcare from someone who doesn't speak your language and having to use an interpreter. But how in some places where there's health disparities and there's low income, they don't actually have interpreters. So there's 3 and 5 year olds having to translate to their mothers that they have terminal cancer. And that to me was just completely struck me, because growing up, English being my first language, I can't imagine what it's like going to a healthcare provider, not being able to communicate properly. Even just knowing Spanish and working in the lab, there's just words that don't translate. So I just can't imagine. That really struck me. So that's why I decided to choose that topic about the importance of healthcare documents being translated properly, and pamphlets and things being given to those patients to make sure that they're able to get proper dosage of their medication, the time of day, the amount, what that medication will do for them, and emphasizing the importance of taking that medication that could potentially be life-saving. But without some sort of interpreter that is, does that for a living, that can really communicate that properly, that medication could be life-saving and possibly not taken at the right times. So basically the underlying issue is the lack of attention that the minorities are getting when it comes to especially languages, not just access to healthcare, but again, if you're living in a place, in America, there's over 350 languages spoken. I literally could only think of maybe 5 off the top of my head. So that means that there's just a huge number of people that maybe aren't even getting healthcare because they know that when they go, there's not going to be someone who speaks their language. And in a small urban hospital, they may not have translator lines. They may not have someone that communicate to them what's going on and how to treat it. So living in South Florida, we have a big Haitian community and a big Hispanic community. So typically there's always providers that speak Creole or Spanish, but we also have the Miami airport. So we can get a lot of people who are from foreign countries that we couldn't even begin to know what their language is or what their needs are. So that's kind of why that struck me for sure. The topic influenced me on how I interact with people because, again, I work down in West Palm Beach, so there's a huge influx of immigrants and people who were not born or raised in America. So it's really important that when I maybe walk past somebody in the hallway and they need help finding the emergency room or finding the restroom, I can be sure that I'm trying to address them appropriately, because I might just say, hey, what can I help you find? But someone who is elderly might not find that appropriate. They might find that offensive or disrespectful. So really trying to learn that will help me interact with people better on a daily basis, not just at a professional level in a hospital, but also in a personal level, just by having that communication, even with the nurses from different countries, and being sure that we communicate properly so that no one's offended, and that the communication between the nurse and I happens so that the patient gets the care that they need and the doctors get the numbers that they need from the lab to ensure that everything gets translated appropriately and the patient gets the right care that they need. So yeah, that's why I chose that. It really just struck home for me. I feel like, being in the hospital is scary, and just want to make sure that everybody gets the proper care that they need. Thanks, guys.